In the field of triple negative breast cancer, we're beginning to see some remarkable advances, mostly centering around really the three paradigms that have become so attractive for the treatment of cancer: immunotherapy, targeted biologics in the setting of triple negative breast cancer. These are the PARP inhibitors primarily, which are targeting on some specific mutational profiles. And then also antibody drug conjugates, the idea of delivering chemotherapy via an antibody, the smart bomb approach, targeting the tumor, minimizing collateral damage, and more effectively delivering a toxin to the cells to create cell death. So we now have our first approval of a triple negative antibody drug conjugate, which has generated great excitement. So a lot of promise there. Also on the triple negative front, many of these patients, when they're at early stage, would benefit from neoadjuvant therapy. Most triple negative patients, because they're not going to be receiving hormonal therapy or HER2-based therapy, are going to be candidates for chemotherapy. And so continuing to work on neoadjuvant adjuvant strategies remains quite the focus of many trial efforts. In the area of neoadjuvant therapy, the addition of the checkpoint inhibitors, that immunotherapy with chemotherapy, has generated some promising results. We've seen the addition of pembrolizumab in this setting with some of the clinical trials that have come to date look quite promising, particularly in terms of looking at deep responses. Pathological CRs is right now the current standard, with longer follow-up needed to look at overall benefits with regard to how these patients might fare for need of further treatment or not. But really, really interesting in that regard.